That was Dr. Muna Sanan with her segment Your Health, Your Wealth, talking about liver disease, or actually kidney health. Now with our main topic for the evening is cardiovascular disease and diabetes. Now cardiovascular disease is the #1 risk factor and complication affecting diabetic patients. 2 out of 3 diabetic patients die of a cardiovascular disease related complications such as heart disease or actually a heart attack or a stroke. Although clinical guidelines put people with type 2 diabetes who need glycogenic and lipid therapy at the same risk level as those with coronary heart disease, nearly 40% of eligible patients do not receive stated treatment. And people with diabetes are 2 to 4 times more likely to have a heart disease than people without diabetes.
I think our viewers Walid tell us important and valuable information, but we have now our guest, Dr. Nabeel Naqshbandi, diabetes and CVD risk. This is the issue for today. Welcome, Dr. Nabeel, and have to be with us in Harmony of Life.
Thank you very much for this interview, and I hope we have very good information to give to our viewers.
When I say the subject for today is diabetes and CVD risk, at the first moment I ask you what CVD risk, what we mean by CVD.
Yeah, CVD, it's the abbreviation of the cardiovascular disease, okay, which is also associated mainly also with diabetes, with high cholesterol and high blood pressure.
Yeah. My first question to you, Dr. Nabeel, what are the % of diabetes in KSA?
Okay, it's according to some international numbers, more than 90% of the Saudi adult population is suffering from diabetes. This places Saudi Arabia as the 7th worldwide of having diabetes through the population, the 7th highest, which is really high percentage for having diabetes as a disease for the population.
Yeah.
You said 90 or 30?
90, 19.
19, okay,
19.
Good. Well, that's even less than 30. I thought 90.
No.
My eyes went. Well, what's the current mortality rate for diabetic patients with a chronic diabetes?
Okay, we have also some numbers about 15,300 something people died yearly from diabetic complications. Okay, and this is a real big number to have in such a country like Saudi Arabia.
Now, diabetes doesn't. I mean, okay, diabetes kills, but it doesn't kill because you have low blood sugar. It kills from a complication usually, right?
Sure,
like a heart disease or
okay,
like a stroke.
Yes,
that's how it works.
Yes, because it's one of the complications. It causes something like this, okay, like the stroke, or like the diabetic coma. Sometimes the hypoglycemia when happened, the hyperglycemia when happened. This is one of the things which is we want to prevent as an industry by having good treatment for diabetes.
Yeah. From a point of view, what is the mortality rate of diabetic patients?
Okay, we already mentioned about 15,300 something died yearly from diabetes complication, and as we mentioned also, it is very high, okay, because it's also associated with another diseases like
heart attack or blood pressure. Yeah.
Well, Dr. Nabeel, as a pharmacist, in terms of the pharmaceutical industry, we already know about the medications that are available in the market to control the blood sugar levels, but in terms of cardiovascular disease, how is the pharmaceutical industry advancing in terms of reducing the incidence of CVD complications in diabetics?
Sure. Okay, let us have it. I believe we have 2 big arms in this industry to help to treat the diabetes. First, the diabetes, as maybe most of the people knows, that it is type 1 and type 2. Type 1 is insulin dependent, and type 2 is non-insulin dependent. If we talk about type 1, which is about 10% of the people, okay, the companies, the pharmaceutical companies who produce insulin, human insulin, they are really doing a very good job to give the customer or the final user for the insulin how he can use it easily without any complication. Okay. From the other side, the type 2 diabetes, which is about 90% of the people having diabetes, the new chemical entities, the new innovative drugs, it is usually discovered by the pharmaceutical companies, and also they try to register it as soon as possible in Saudi Arabia, so to give Saudi Arabia and the people who suffer from diabetes the new medicine, okay, the new group of treatment, of drugs, okay, to treat the people. They want to register it as soon as possible to have the privileges with less complication, less side effects, and of course high efficacy. This is one arm. So to have a good product, this is one arm. As MSD, okay, we do have one of the new innovative product. Januvia is doing a very good results for controlling blood sugar. Yeah. And also to reduce all other factors, risk factors for cardiac problems. The other big arm from the pharmaceutical companies is how to be with the community, okay, to increase the awareness of people about how dangerous is the disease, and how can they reduce even the use of the medicine itself, okay, being to predict what if this guy has of the patient, or the patient has the same family problems, or there is some increase on percentage to have diabetes, or to have some cardiac problems, or to have high cholesterol also, which is also covered by our company for high cholesterol, high blood pressure, and also diabetes, which also one of the risk syndrome for cardiovascular disease and diabetes. So being part of the community, helping the community to do this is very good. One of the main issues and the main program has been happening with the GCC Executive Office in Saudi Arabia. Yeah. Okay. Dr. Tawfiq Khoja, the head, His Excellency Dr. Tawfiq Khoja, the head of this office, they have a very clear and beautiful program for the non-communicable disease, okay, which is diabetes is there, high blood pressure is there, okay. This is to make it simple to the people, okay. There is no bacteria or virus, okay, behind diabetes, or behind high cholesterol or high blood pressure, okay. There is not. It comes maybe sometimes familial, okay, and it comes sometimes without reason.
Okay. It's just like an organ failure or
something
from lifestyle. And
yes.
So on. Yeah.
And lifestyle after this. Yeah. So to make the lifestyle, the harmony of life here, we are in the same program, talking about lifestyle, talking about how can we increase the awareness of the people, and the awareness of the normal people about obesity, about
I mean, no matter how strong a pharmaceutical company is, the only way you can really, no matter how much their efforts and their progress, the best way they can really tackle something is by creating awareness and preventing it in the first place.
Yes. So, participate in this community service, okay, and thanks God, me myself and all members of MSD is one of these good people, I hope, doing these programs with the officials.
No. If we're going to go with a report, and then we'll be right back to tackle this discussion.
Sure.
Thanks. And we're going to go with the report. Stay tuned.
Welcome back, our viewers. I think very important report to speak about obesity and how we can avoid increasing obesity or diabetes or blood pressure in the blood. During our discussion, Dr. Nabeel, you mentioned that we have two types of diabetes. One of them, the first type, if 10% of people are having diabetes from this type, and the second type, 90%. My question to you, what is the difference, the huge difference between the two types, and what about every type, the treatment, why the difference between them?
Okay. From a pharmaceutical point of view,
Yeah.
okay, the difference is the medicine, okay? Because type 1 is insulin dependent. The pancreas cannot produce insulin anymore. Okay, so the blood sugar comes high. Okay, and we cannot treat this type without insulin injection. So this is one difference. The second one is non-insulin dependent. You can use tablets. You can use medicine also to increase maybe the receptors for insulin. Maybe you can increase also or enhance the pancreas increase of insulin. So this is the main difference in the two types.
From your point of view, how it is important, the early diagnosis of diabetes?
Sure. This is what I said before. There is a lot of effort from the pharmaceutical companies, especially MSD, is how to know the family history first, okay, to encourage people to do the test maybe twice a year for blood pressure, for cholesterol, and also for blood sugar, so we can know who is the high risk to be as a member of the family, and plus, of course, doing the part of exercise or a good
physical
lifestyle. Okay, it's very important.
It's very important, yeah.
Well, Dr. Nabeel, going back to the methodology of how the drugs work, you said in type 2 diabetes, when the patient is insulin dependent, you give him insulin shots.
Yes.
And then the other
type 1.
Type 1 diabetes.
Okay.
This is when the pancreas cannot produce insulin. So the person is dependent on insulin shots. The other type is, type 2 is the one where he's administered tablets.
Yes.
These tablets are supposed to help the pancreas develop insulin, or?
Yeah, there is different way, okay, for the tablets to work. Sometimes they decrease something to increase something, okay, or they increase the receptors for insulin in the cell itself. So it can help,
so it can produce
for more,
more.
Or even the same quantity of insulin will go to more receptor. So this will give more control, okay, for the blood sugar. So it depends on the kind or the group of the medicine for this treatment.
Yeah.
Is there a drug that's specifically supposed to decrease the chance of the CVD incidences in general, and how do they work?
Yes, if you stabilize, if we want to talk now about the cardiovascular events, all the cardiovascular disease or events, okay, we have the high blood pressure, the high cholesterol, and the diabetes. Okay, so if this factors or this disease is normal, okay, some patient has high blood pressure, okay, but it's controlled by drugs. So at the end, we control the whole complications and the whole story of having some cardiac problems. It is the same for cholesterol also, how to maintain the level of cholesterol, and it is also the story for diabetes. So the control, it is very important. The control maybe can be medicine, and it can be lifestyle, can be exercise, can be whatever. So it is very important to diagnose before, okay, to know before that this is high-risk patient or high-risk person for diabetes or for blood pressure, and try to maintain this. This is the, as I told you, the non-communicable disease. Okay, this is very important, and this is, I think, the program now is it's run. It is start from the GCC Executive Office, and now it runs also through the Ministry of Health.
Yeah, Dr. Nabil, as a pharmacist, what about the new technology of treatment or medication against diabetes or CVD risk?
Okay. We as an MSD company, we are a mother company, an innovative company. We took the research and development seriously and strongly to serve the patients and to have more possibility for good medicine. It is not only because, as you know, there is a lot of abbreviation that we are the third world or something. But MSD as a company, Saudi Arabia is as important as US after having the drug approved with the US FDA. It can be directly shipped to Saudi Arabia and approved by SFDA here in Saudi Arabia.
Yeah.
Well, that's great to hear. Well, let's go on a report on diabetes and obesity, and then we'll be right back with Dr. Nabeel Naqshbandi continuing our discussion. Stay tuned.
Very valuable information to all of you today. We discussed in how many of life diabetes and CVD risk and how to avoid, and what about the medications and new technology with Dr. Nabeel Naqshbandi. I think that my colleague Walid have important question to Dr. Nabeel.
It is a very important question, actually, in terms of the, in addition to the medication that a diabetic person may take throughout his life, how important is sports in reducing the incidence of having CVD-related complication?
Okay. It has so many meanings as sport. Sometimes people said that, okay, I have to be...
He doesn't have to climb a mountain or run every day.
Or to be a bodybuilder or whatever. But yeah, it's very important to walk. Okay, there is a lot of says that if you walk for half an hour per day, you will maintain your blood pressure and you will maintain your sugar level. Okay, this is something popular between people, but it is good also to have some jogging and run every now and then. Okay, because this also will have a good impact for increasing the HDL in the blood and also maintaining the blood pressure and the diabetes. Sports or exercise is very, very important to avoid such kind of risks from the disease.
We were built that way. I mean, well, not built. We were. I mean, humans are supposed to. They're supposed to hunt for food. They're supposed to. They're supposed to be active, and I truly believe that because of our very, very sedentary lifestyle that we have now, this is the reason why we have so many chronic illnesses that show up in our society. Don't you think, May?
Yes, of course.
But there is a lot of help, if you allow me for some second. Okay, there is a lot of help from the government now. If you see, especially in Riyadh, we are in Riyadh, there is the, I will call it in Arabic, it's Shara al-Hawamila or whatever.
Yes.
Yeah, it's a very good places to walk.
It is,
okay? And it is not only this one. There is another one around the...
We're having more of these, walkways.
Yeah, walkways and good streets so you can walk without any problems or any cars or any risk.
My final question, Dr. Nabil, do you think that our Arabic society or in the Middle East have enough culture to deal with diabetes or CVD risk? And brief, please.
That's why we need more awareness. Okay, we need more awareness. Okay, I think the responsibility become to the official as MOH officials, and then to the drug companies to help in awareness, just to decrease this risk and this dangerous disease.
Yeah.
Well, Dr. Nabeel Naqshbandi from MSD Pharmaceuticals, thank you very much for being with us on the program.
Thank you so much.
Thank you very much. Thank you. It was an honor.
I think our viewers, Walid, we have a report and we'll come back to complete the end of Hamlet Flat. Let's see.